Hi, welcome to my Zoominar. Today we're going to talk about the difference between your butt pain that's from lower back or leg pain from your lower back, or is it just from the tight muscle that you have in your leg? Let's start going through some of the basic symptom patterns to know the difference.
So oftentimes the most common question I get from patients is that, is my leg pain related from my lower back, or is it my leg pain is just something that is local region? And oftentimes the most common word that we hear from patient is, I have sciatica. Well, when you have sciatica, is that from the nerve root region of your disc? Or is it just a local region? This section is called the sciatic nerve, which is below your buttock, right above your knee. And this section, we call it the sciatic nerve. So the question would be, well, is it local muscle referral pain? Or is it a nerve root referral pain? A nerve root referral pain usually would have a pattern. Usually this is L4. L4 will actually give you a pattern that goes from your lower back. Sometimes it's not exactly like that. Patient may say, I got something, it feels like on the side of my front. And then it goes above to the knee or below the knee. Okay. And if it's anything below the knee, it's most likely L4 and below. If it's anything above the knee, it's L3, L2, L1, and above. You have L5, which goes all the way down, and you have that same pattern to the side, all the way down to your leg, and then, but it has something on the top of your three toes on the second, third, and fourth. Most likely, patient may say, it feels like it's kind of numb. And S1, it'll go from the back of your leg all the way down, and you may have something on the heel or on the bottom of the feet. So these are the common things that you may have. And if you have pain was identified by your physician or by your friend or a physical therapist that is sciatic nerve interference, well, you kind of want to know, is it the entire thing? Is it partial? How do I know? If it's a muscle region, you can see that the pattern of a sciatic can show up as the entire thing versus you could have just a muscle tension such as iliopsoas. Iliopsoas will present, this is the deep muscle that I will show you later. It would present itself as, the front of the quad muscle that's tight or your back tension is there. If you have gluteus minimus, this is one of the standing muscle. When we stand, we use this muscle quite a bit. It's the buttock region right around here. Well, you could have that muscle tension pinching on your nerve. That gives the almost same thing as sciatic pain that goes down to the leg or nerve root pain that goes down to the leg on the side. Same thing as piriformis. This muscle can mimic pains that is almost like a sciatic nerve because it pinches the nerve region and they give you that sensation down further. We have deep quadratus lumborum muscle that also give you buttock pain. And so sometimes you don't know which is which. The best way is to know that maybe when you stretch these muscle and the pain goes away, that's a good sign that it's just muscle and it's not nerve root. When it's nerve root, it's much deeper and it won't go away right away. Okay, here are some pictures to show you that these are the muscle. The X marked where the muscle is. The blue marks where the feeling of that sensation shows up. So you could have the standing or the ITB band muscle, the running muscle, and it shows up as pain on the side or buttock region. The standing, the earlier when we said the gluteus medius, that give you the pain feeling all the way down. That could mimic a disc injury. But if you just stretch this muscle out and your pain goes away, then you're in luck. It's just a muscle tension. Now, a different set of injury that could give you pain down your buttock or your hip region is that some people have femur head fracture. This often occurs to senior patients who have lost their bone density and they fall. Most likely, you've heard the word osteopenia, osteoporosis, and if you're not aware, a fall right on your buttock and you could crack these head of your femur. And that could give you the same pain that we were showing earlier. But of course, nowadays with technology, surgery is really easily done to help save you. And oftentimes with this repaired, you still have your muscle preserved and you could be walking in just days after the surgery. Pelvis fracture could often occur for seniors or trauma as pedestrian injuries, motorcycle injuries that could occur, and those pain pattern could also show up. Now, the most common thing that we always chase patients in chiropractic is posture, because how you use your muscle through habits makes your muscle tone change through days and month and year. If you have an anterior pelvic tilt versus you have a straight back or you have a forehead, all these could cause prolonged muscle tension increase on one side versus the other. If you really think about it, when you're cooking, do you stand with your one leg? Do you stand with both leg evenly, pressure down, or you shift it to one side? When you stand in line, or you sit waiting at the doctor's office, are you even? Are you cross-legged? Or are you lopsided? Often our weights are not always even. If you really think about it, when we sit, we slouch, we look forward, we look down, we look at our phones, we look at our iPads, iPhones, all sorts of things. Are we sitting straight? Are we actually slouched? And all these muscle contraction, what this is what we call the hip bone or the iliac crest. Iliac crest is something that we can actually put our hands on our waistline, and that bone is what we call the iliac crest. All our lumbar muscle are connected to the top of this crest, and our buttock muscle and the leg muscle are on the bottom of this crest. And often we don't think they're connected. There could be a tug of war going on. When you sit, if you sit straight, this is considering sitting straight, pretty straight, except there's no cushion. So then there's tension on your legs and your back as you sit as straight as you can. Often then we don't think our leg muscle is in use when we're seated. In this picture, you can see that the muscle, especially this one, iliopsoas muscle, is contracted, which connects from your lumbar to your big thigh bone here. Often, if we sit with a cushion, it actually releases a little bit, help us balance our weight as we sit. And that's why I often ask patients to preserve their lumbar curve, which is very important. Now, when we talk about core muscle, we have the outer core muscle, which is the ones that we always talk about: six pack, oblique, transverse abdominis. We have the deep ones that is called the multifidus and the back muscle. We have the diaphragm as part of it, and we have all these, the deep core muscle. Oftentimes, we only think about our core muscle as in just the six pack, but part of that, our back muscle, is also considered part of it. This is the iliopsoas, one of the most powerful hip flexors. To bring your knee up, this muscle needs to work. It connects from the front of your lumbar all the way down to the femur neck region. When you have tension in this muscle, as you can see in blue, you could have pain in the back as back pain, or you could have pain in the front thigh region. To stretch iliopsoas muscle, you simply can do this, what we call the arch your back bridge way of stretching. One that we often see or don't think about when you do warrior pose. As you lean back, there's that stretch for the iliopsoas muscle. Bridge is really easy. Oftentimes we can just do this laying in bed. In this case, iliopsoas muscle is being stretched, except you're partly contracted standing on one leg, and you're trying to grab onto your toes. I don't consider this stretching. This is more of a posing contraction. Let's talk about what's stretching first. Stretching must move to the end range of motion. This means your muscle needs to be stretched and pulled to the end. You must count your breath and not seconds. We ask minimum of 5 breaths in and out. And you must feel the stretching tension of that muscle. It is not posing like I showed you earlier in this view. Posing really has a lot of contraction. There's not really a whole lot of relaxation in these moves here. Now, if you just relax with your leg up in the air, that's really relaxation. Nothing's really being contracted. This one in particular, it's for hamstring. And you can easily hold on to a belt and hold on to your leg, pull it towards you. That's for your hamstring and calf muscle stretch. You could lay on your back. You could even lift your hip a little higher above, like this yoga pose, which stretches a little bit of your neck region, and it brings the content in your pelvic down to your body. It's a nice one. In the same way that people can bring their leg over their head and relax like this, this stretches your leg muscle as well as your back muscle, as you can see it on this back view here. Now, same thing, if you can't achieve that, you could actually stand. and stretch your hamstrings, buttock muscles. If you're not laying down, you could be standing. Now, downward dog is the most common posture we see in yoga, or it's highly recommended in a very simple way to stretch your hamstring, your back muscles. And if you can't really keep it straight, here's the key. You need to make sure your lumbar arch is preserved. And if you can't keep both legs straight, at least do one at a time. You could bend one leg first, keep one straight, and then change leg. Okay. So in stretching this, breathing is the key. And what you're doing is you're trying to push, you get your latissimus dorsi stretch. This is one of the biggest back muscle that attach all the way to your arm muscle, and your hamstrings being stretched, and your gluteus maximus, all these muscles are being stretched. The key is you must breathe in and out, take your time. Okay. The reverse of downward dog is upward dog. And the upward dog stretches the anterior core muscles, and it also stretches your quads, iliopsoas muscle as well. Now, some people, they would ask, what can I do to strengthen the back muscle? The easiest back muscle is the Superman pose. If you're on your bed, on the floor, just lift your legs and your arms up in the air. That simply will activate all the back extensor muscles, hamstring, glutes, and calf muscle. If it's hard for you to do, you could do this on a ball. You can lift opposite hands and leg, and you can switch from side to side, or you could do two arms first, and then you hold your arms down on the floor, and then you lift two legs up in the air. When we do the bridge, the safest way is right over a ball or a chair. And when you're doing this actual bridge, if you're that good that you can actually touch the floor, then you'll feel quite a bit of muscle being stretched. But before that, you can simply do the easy way, which is rest over a ball or a bench, and you can just relax yourself. It's a lot more easier to do. Crossover stretches are the best. Oftentimes when we want to stretch this tiny little muscle, it's cross your leg, bring it up to your chest, cross your back, or cross it over. It's opposite hands and knee crossover. This is a laying down stretch. You could do a seated, having your elbow and knee cross over, left to right, right to left. And it's as simple as that. You could be laying on your bed or on the floor, turn your head to the left and bring your legs to the right, just the opposite. You can see in this picture, everything is being stretched. So if you don't have time at the end of the day, what I always recommend is crossover stretches. It does quite a bit. The reverse stretches are good. If you can't do this, you could do it the other way. See the two pictures? This is laying on your back. You get your back stretch, your hamstring stretched, but you could just roll to the front and down. That gives you the same thing. You don't stretch a hamstring as much, but you get a little bit of your back and buttock stretch. Splits. Splits are always good. If you used to be able to do splits and now you don't, I would still recommend try to do half splits if you can. It's really important to try to stretch as much as you can on your hamstrings and your calf muscle. If you can't hold on to your toes, you can use a towel to try to reach and pull. As long as you're breathing in and out, when you breathe, your diaphragm expands and all the muscle around that's attached to your rib cage gets stretched as well. And you can do the same thing. This also gives you the same effect in a different position. As you can see, this is for the hamstring. This also gets your hamstring and quads all together. Only if you're capable of doing it. If you're not capable of doing such move, I would modify to whatever that fits you. Now, you could also do standing lean over. And if you can't touch the floor like this picture, you could hold your hand over the chair and you still get the same thing. Or you could have one leg cross over to the front and that would achieve the same thing. Now, this is one of the least stretched muscle, which is the most important muscle I find in my practice that people are skipping. The adductor muscles. Those are the inner muscles in your inner thigh region. And it's very easy to stretch. It's the side split or just bring your leg out sideways towards you. If you can't hold onto your toes, grab onto your knee. And this muscle, if it doesn't exist, you'd be walking with your legs open. Or when you're seated, your legs wouldn't be able to pull together. It's only because of all these muscles that you're capable of walking with your leg close to each other. Sideways, you could do a standing, but this is half posing. So I recommend on the floor if you're capable of doing that, or put your leg on the bed and squat down. You can get the inner leg stretch. Same thing as crossover. You could do crossover stretches. Okay. I like to show you several crossover leg stretches. You don't always have to be on your bed. You could be standing doing warrior pose with your arms and leg crossing over on the outside of each other or on the same side. Either on the same side or on the outside. These crossover stretches are wonderful to do during the day. Downward dog, when you're not capable, once again, bend your knees and shift a little bit until you can stabilize yourself to feel that you can get that leg stretch, hamstring stretch all together, but make sure that your back is actually arched flat, not hunched back with a round back, okay? Child pose is one of the best relaxing posture to be in. And this stretches the glutes muscles, the deeper buttock muscles, and your back muscles as well. It stretches all the way out to your armpit. And so it's best to end with this posture every day. It definitely will bring you some benefits.
Today we're going to go over some things that we will be using at home. And some of you may see this foam roller, which is pretty common that you've seen from your physical therapist that we use quite often. Next grade up is a vibrational foam roller. This one vibrates, high frequency vibration. It's not a big rocking sensation, but it's just high frequency, very fast. And then if you don't like these hard surface roller, you can use a squishy air foam roller, right? And then one of my favorite is red squishy nodule ball or nodule massage ball. So if you got these at home, pull them out. I'll be showing you how to use them.
Okay, so to stretch our hamstring, if you have a foam roller, roll while you're trying to stretch. The key is you have to feel like you're stretching that muscle while you're rolling on it. Some people are just kind of rolling on it with their knees bent. Then you don't really feel that muscle being stretched. The key is you have something on it. If you have a vibrational roller, that can be done just the same way as you roll back and forth. It'll help you stretch your hamstring much faster than not having any equipment. Now, as for quads, it's in the front. So try to straighten your leg and have your leg on the side. You roll up and down right on the quad that's being stretched. You want to try to extend your back up, and as high as you can, you will feel the quads being rolled, and it should give you a little bit of that sore, painful sensation. You can use the air inflatable tube one or even the red little spiky ball. Any equipment as you wish. It's actually helpful when your muscles being stretched, you have something pushing right on there. Now to stretch the quads in the front, you could have your foam roller behind you. So then you could rest, and to stretch your quads that actually goes into the inner knee. You can slowly lay down so that you can stretch the quads that is closer to the inner knee that comes around. All your quads muscle, there's 4 of them that all come across to the front of the kneecap, and it goes down to the front of the shin bone. Okay. And so when you stretch your quads, if your knees bent, you get actually a deeper effect. Now here's a video of what I'm going to show you. One of my favorite way of using a red inflatable massage ball. You put this ball behind your back when you're laying down. And what it is you rest your head, you bring your leg up. As you bring it up, if you could bring it all the way up towards you, this stretches the back of your lumbar, the buttock region, and also it releases the lumbar pressure off. So if you're capable of holding in this position for a little bit, as long as 5 to 10 breaths, it'd be wonderful to release your lower back tension. And if you're not capable of bringing your legs straight up over your head, you could just bend your knees. That will give you the same effect. Here's a picture showing you that by having something on your buttock, it actually releases the tension. This is piriformis muscle, gluteus medius, and gluteus maximus. You can roll right on the buttock muscle, or you could roll on the side, or simply bring your leg close up towards you as you're laying down. The longer that you could breathe in and out and relax on this position, the better it is. Remember, stretching isn't motion. Stretching is really not moving and just breathing while you elongate or stimulate the muscle tension as you breathe in and out. Here's another one to show you. This one is for the piriformis. You can roll in a circular motion, okay? And you have your arms and legs on the floor, just one, you sit right onto it. Here's a way to release your piriformis muscle or buttock muscle, the sitting gluteus maximus medius muscle. By rolling onto this inflatable nodule ball, it actually stimulates that muscle deep enough for you to feel the release, okay? You can roll on the right or left, take your time and do it on your own. You could pause the video. And you could also roll side to side, which runs a little bit on your ITB band. That would be nice as well. Here's a different view. You can roll side to side, try to stabilize yourself and have the ball right where your soreness is. Wherever you find your soreness, you can roll on it a little bit more. And then besides side to side, you could do circular motion, and you could even go up and down. So find the spot of your tension and roll on it as much as you can by breathing and try to relax. So once again, you could have your arms and legs on the floor or in bed. Just tuck this ball behind underneath your buttock or back region, the lower back region, and roll side to side, turn and shift. You could bring your leg up over your head. That will give you some release on your lumbar tension. Whenever you do this, if you have discomfort, numbness, tingling sensation, then don't do it. This is strictly done for a healthy individual to release the muscle tension from daily activities. Okay, so here are some of the videos that you can actually go online and watch on your own for more detailed information about lumbar radiculopathy versus sciatica. Let me share the screen of what to search on YouTube. Okay, so on YouTube, sometimes most patients don't really see back pain as the word lumbar. Lumbar is actually the spinal segment of your lower back region. And so to get a better picture of understanding, you can type lumbar radiculopathy, and that'll give you better. There's doctors who've done, or some institute have done great videos on these lumbar nerve root impingement syndromes, okay? And the other one is sciatica. You could type sciatica on YouTube and you will have great videos that you can watch, some spine centers, and they're actually great. You will have better understanding of what exactly is going on inside the body. The more you understand about yourself, the better it is. Then there's my favorite PT, Bob and Brad. Bob and Brad actually have a lot of videos and very high hits of anything that you would like to understand. And you could go into it. They go into details of explaining a lot about corrections of your pelvic tilt, anterior carriage, pelvic issues. So there's quite a bit in there that you can search. These are the most common reference I've given to patients. And then when patients ask me about stretching, Maddie Morrison, I really like her. M-A-D-Y, Maddie Morrison. She has wonderful stretching sessions. They are as short as 10 minutes, 15 minutes, up to probably 45 minutes in an hour. Her stretchings are wonderful. They're both sides, and it's easy music to follow through. You could follow through different video one a day. I think it's wonderful. Then since we're on pelvic exercise, the best is this Korean mom who actually started this exercise where she's not jumping. She's not doing really fast motion. It's purely spinal, pelvis, and it's really easy to follow. She counts to 8 and everything. Really easy to follow in the entire session. And what you will see by going through just 20 minutes of this, your spine gets warm and hot, and your pelvis gets nice and rolled around. And you can see in the middle section here, it's left and right shift. Do you remember when you do her video? This is one of my favorite. She has a lot of video, but I only particularly like this one with green khaki pants. Notice she has her knee bent all the time. To get the best pelvic motion, your knee should be always bent in doing this exercise. She goes in circles, full left and right. Okay. And when you have a really good bilateral hip movement from front to back and side to side, it actually mobilized the entire lower back core muscle and your leg muscles. Okay. This is one of the earlier ones that she had out way back, I think about 10 years ago. I really was recommending her videos to patients. She's got new ones, and the new one is this one, which is also wonderful. It's slow, takes you through the motion with your pelvic motion, left and right. Do remember the knees bend. She sometimes lifts up her leg. You can see how they do it, and then left and right shift. It's really easy to follow as long as you are watching a mirror of yourself. A lot of time we watch the video and we think we move just as good as they are, but sometimes I recommend watching yourself in front of a mirror. Okay, then there's what videos I've already made where a patient asks about how to use these spiky ball that I always recommend. So this is the video that's already published online. You could roll your pelvis. You could do a laying down as well. Okay. And these are the things you can do at home to help you release those deep set of lumbar muscles and buttock muscles as ones I showed today. Thank you for watching this video. I will see you in our next webinar. Have a wonderful weekend.